So one of the radiation monitoring devices you come across in veterinary medicine is called the dosimetry badge. The dosimetry badge is a very small clip-on badge that you're going to clip on the outside of your personal protective equipment when you're taking x-rays. The dosimetry badge works to measure radiation. The film dosimetry badge, it has a small piece of film and it's wrapped up in a light-proof envelope. And anytime you and the dosimetry badge are exposed to radiation, that dosimetry badge measures how much radiation you're exposed to. When you're ready to get the readings from your dosimetry badge, you're going to send them out to a certain company that obtains those readings for you. They're going to obtain those readings and then they're going to send you what's called a dosimetry report and a new batch of badges. The dosimetry badge should always be worn when you're taking x-rays, assisting with x-rays, working around the radiology suite while x-rays are being taken. And then the dosimetry badge is usually worn clipped onto the thyroid level. So it's normally worn at thyroid level or kind of mid-height of the chest level. And then the MPD annually, which is measured in milligrams, is 5,000 milligrams annually. And we will go ahead and go with this person. This one right here. So for her body dose, in this current report, she hasn't taken any x-rays. And then in this column here, it's going to show us our dose this year. So her deep dose, which is her deeper internal tissues, is 101. And then for her eye dose, which is her eyes, her lenses, is also 101. And then for her shallow dose, which is her extremities and her skin, is 100. So this is going to be below the MPD for the year. And then if we come to this last dose, we have also our lifetime dose. Our deep dose is 167, our eye dose is 171, and our shallow dose is also 171. Again, she is going to be underneath the lifetime dose. So she's under the MPD annually and also under the lifetime dose. So right now I'm going to go ahead and put on my personal protective equipment. A lot of times before putting on personal protective equipment, you always want to visually just look it over, make sure there are no holes, tears, or cracks in your gown that you're going to put on or your thyroid shield. You're going to want to do this because that's going to decrease the possible exposure to radiation that you come in contact with. Any cracks or tears or anything like that, you're going to want to report to your safety, your radiation safety officer. And of course, now would be the time that I'm going to put on my dosimetry badge. Again, I'm just going to clip it at thyroid level. Another personal protection equipment that we do have here are goggles. Your hospital may not necessarily carry goggles. If they do, it's always a good idea to go ahead and put your goggles on just for the radiographs. And then of course you always want to make sure you have your gloves out handy and ready to go. Again, when you're putting on your personal protective equipment, you always want to make sure there's no cracks or tears in it, and this is to decrease the amount of radiation that your body is exposed to. So I'll just finish putting these on real quickly. And so this is what you would look like completely fit with your personal protective equipment. So there's a couple different methods you can use for restraint in radiology. The first method is more of a manual restraint where you're going to be using your sandbags. There's V-troughs that come with ropes or ties in them. Sometimes you'll need a little sedation for the V-troughs and ropes and ties. That kind of goes along with the sedated aspect of restraint, but that's a more manual restraint of doing it. And then there is the physical way of restraining, which is going to take you and usually someone else. You're going to position the animal and physically restrain them and position them to where you need them to be positioned. And then one of the last forms of restraint is chemical or a patient that is sedated. And this way you can sedate your patient, step behind a wall, and take your x-ray without being exposed to radiation. So some of the positioning aids that you can use in radiology, one of them is stretch gauze. Stretch gauze is good if you're taking views of the toes, carpus, or any of the legs. This will help you pull the leg straight while keeping your fingers out of the view. Another one is the V-trough. This helps keep your patient straight. There's also sandbags that you can use for helping position legs or keeping the back of the patient straight while you're taking certain views. Those are just a couple of our positioning aids we have here. There are also foam wedges that are good for taking obliques that can help you kind of rotate the patient. Another physical protective barrier that you can utilize while taking radiographs is a wall. If you have a sedated patient that's already positioned on the table, you can step out and behind the wall, and you can use that as a physical protective barrier. Distance can also help you come in contact with less scatter radiation. The further away from the patient you are, the less that scatter radiation is going to come in contact with your body. Time is something else that can help lower the amount of radiation you're exposed to. You always want to choose the lowest time setting possible when you're making your exposure. So you don't ever want any part of yourself in the x-ray, whether it's shielded or unshielded. Unshielded, you are, again, you're going to have to retake that radiograph, and then you are exposing whichever portion of your body is in that film to a full dose of radiation. Even if your hand is shielded, say you have a gloved hand in with your x-ray, that glove is only going to decrease the amount of primary x-ray beam by 25%. So even if your hand is shielded, you're still getting a nice dose of radiation to your hand, and again, you are going to have to retake that x-ray. So non-essential personnel should be removed from the x-ray suite while you're taking x-rays for a couple of different reasons. For one, they can be a distraction to you and your patient both. And for two, even if they are gowned, if they're not necessarily needed at that time for that x-ray, they should be removed to decrease their exposure to radiation that they don't need. So anytime you're taking x-rays, you always want to try your best to get a diagnostic quality image on the first try. One reason is it's safer for you and your patient both. If you have to sit in the x-ray room and retake continuous x-rays, you are being exposed to a higher dose of radiation, as is your patient. So people under the age of 18 and pregnant women shouldn't be taking x-rays because of the damage it can do to their DNA and their cells. Women that are pregnant really are at a risk during the first trimester. That fetus is growing rapidly, their cells are dividing, so that can cause genetic and DNA mutations in their cells. So pregnant women shouldn't be taking x-rays, and anyone under the age of 18 who's not done growing yet shouldn't be taking x-rays due to the fact that a lot of the radiation can, again, cause damage to their genetic material in their cells, which can interfere with bone growth, certain types of skin growth, certain cell growth, and anything like that. So right now we're going to put in a patient that we're going to be doing some x-rays on. This is our computer system that we use. We have all digital radiograph here. So to begin, we're just going to add a new study. We're going to do the patient name, which is either the dog or cat or whichever type of animal that you're doing it on. Today we're going to be doing it on a dog. So we're going to enter his name in, and we're going to enter in the owner's last name, and then we're going to enter in the client's chart number, and then the patient's first name. And then we're going to enter in the amount of KIGS that the patient is, species, canine. Then you're going to pick your technician that is performing the study and your veterinarian that is requesting the study. And then here we have our regions that we're going to be able to select. So today we're going to be doing a VD thorax, so we're just going to do the chest. And these pop up here, so we're not doing a lateral today, so we can delete that one. And then we're going to be doing a craniocaudal of the radius and ulna, so we're going to go ahead and select that one. On this one, it doesn't necessarily have a craniocaudal setting. It's described as an AP in this machine, so we're going to delete the views that we don't need. And then the last view that we are going to be doing is a VD pelvis that's going to be OFA quality, so I'm going to click the pelvis series, select that, and then I'm just going to keep my VD view down there at the bottom. Okay?
Ready.
So right now I'm going to go ahead and do the chest VD on my patient. I've already got my settings off of my computer program, and I've already set them into my x-ray machine. If I did have to measure this patient, I would measure at the thickest part, which is normally the last rib, and then I would check my technique chart and get my settings off of my technique chart, and then I would put them into my x-ray machine, and then I would choose the appropriate size cassette that I would need for the body part that I'm x-raying. My particular x-ray machine that I have does not have the need for different cassettes. Is what we do have is we have a permanent cassette down here that is digital, so we don't change out our cassettes or anything like that. Alright, so I've got my patient here. We're going to go ahead and do the VD thorax. My collimation anatomical markers are going to be, for the VD thorax, my centering of collimation is going to be at the midline and kind of at the caudal border of the scapula, and then the cranial border for collimation is going to be at the thoracic inlet, and then the caudal border of collimation is going to be at our first lumbar ridge. So we're going to go ahead and turn Mr. Rudy here. Good boy, he's okay. He's okay. So we're going to make sure to get him nice and straight. Down just a little bit. I'm going to pull his arms up out of the way. And then I'm going to go ahead and get my x-ray on a nice big deep breath. Alright, so this is the view of the VD thorax I just got, so I'm going to go ahead and save my view. I'm going to come down here and push the save button, and then I'm going to add in my label marker, and this label marker is going to come up here to the axilla, and that is where we are going to put our label marker. So right now we're going to go ahead and we're going to take the craniocaudal radius ulna view. I have, again, my system here is ready for the view, and I need to reset my machine. My KVP is going to be 70 and my MAS is going to be 5. So I'm going to come over here to my machine. I'm going to set my KVP at 70. And then my MAS is going to stay at 5. So my KVP is at 70, my MAS is at 5. Alright, so right now we're going to be taking a view of the craniocaudal radius and ulna. I'm going to go ahead and use some stretch gauze and just tie that around the paw to help me pull his arm forward. And then I'm going to place some sandbags on the side of it to just kind of stabilize it. Again, if I was measuring this patient for my view, I would measure at the mid-shaft of the bone, and then I would obtain my technique off of our technique chart, which is our KVP and MA settings, and then I would choose the appropriate sized cassette. So we're just going to go ahead and position my patient here. And for collimation, examination, I'm going to get proximal of the elbow and this distal of the carpus. I'm going to go ahead and take my view. Good job, Barney. Alright, so we've gotten our view for our craniocaudal radius ulna shot. And that is right here. So right now I'm going to go ahead and add my marker. Now this is the right leg that we took an x-ray of. So I'm going to come down here. I already pushed on that little button, my right left marker, so I'm going to click on my right marker. Sometimes it takes a minute to pop up. I'm going to drag this to where I would like it. And we're going to put that there. I'll come back down here and I'm going to push save. So right now we're going to try to do a VD pelvis. It's going to be OFA quality. Rudy here's had just a little bit of sedation. If we need to give him some more sedation, we can always do that. Our machine here already calculates everything that we need to put in. So my setting here is going to be, my KVPs are going to be 80 and my MAS is going to be 5. So I'm going to come over here to our x-ray machine. I'm going to set my KVPs to 80 and my MASs are already on 5. And then if I was going to measure him, I would measure him at the widest part of his hips. And then I would use my technique chart to obtain my settings off of that. I have a bigger chop here. Alright, so we're going to go ahead and get him all positioned. So my lateral border are going to be my lateral walls. My cranial border for collimating is going to be the crest of the ilium. And get myself all collimated here. So when you're doing your OFA x-rays, you want to be able to completely roll in his hip joints. Make sure they're completely lateral, parallel with the table. And then you're going to go ahead and you're going to make your exposure. Alright, so I went ahead and I made my exposure to get my VD pelvis that's OFA quality. So this is what I have right now. So here's my right marker, which we can use. We get our markers from the screen right here. It has a setting right here that you can push that pulls up your right or left markers, and then it goes away when you touch the screen. Or of course you can say grab your left marker, and I'm going to pull it down here, and I could place that marker right there, but I don't want that marker there. So that is my OFA quality VD pelvis, and then I'm going to do this. I'm going to save that view. So this view is permanently saved in this patient profile. And so now my radiograph has a marker on it. So now is what I'm going to do is I'm going to go in and add a notation to each of these x-rays of really what they are. So I click this button, I'm going to come up here to my pencil, and I'm going to pick a custom notation, and my board pops up, and I'm going to be able to put in what type of x-ray this is or what I want to say. So this is going to be the right craniocaudal of the radius. So do that, and then we're going to come down here and push enter, and so this will pop up. And right now, what I'm going to do is I'm going to kind of cut it down just a little bit and bring that to my most hollow border of my x-ray, and I'm going to come back over here and done. And so that is my permanent film marker that will show up on my film. So I'll go ahead and just do that for each and every film that I have. This is our VD pelvis. It's an OFA quality. Again, I'm going to click custom. My annotation is going to come up. And that's going to come up, and I'm going to bring that down here. Again, I'm going to do that. And the last one I'm going to do is my VD of the chest again. I'm going to and so I'm going to bring that down just a little bit. So there's that. And I'm going to push done. So all of my films have a... Alright, so right now I'm going to go ahead and place one of our films that we have here in our darkroom. This has been an exposed film, and to place it in the appropriate sized envelope, you're going to try to find an appropriate sized envelope. Envelopes will differ on the width and length of them depending on what type of film you're putting in them. I'm just going to gently place your film inside your appropriate sized envelope. And, label our envelope, and I'm just going to use a regular Sharpie to label it. So we do the owner's first name, and then the owner's last name, the date that the film was exposed. So if this film was exposed today, I will do it for today's date. And then the initials of the doctor that requested the film. And then down in remarks, we're going to write what the film is taken of. So this is a lat of the lateral thorax. So next, when we're filing this film, we're going to file by last name. So all of our old actual radiograph films are up here, and they're all filed by last name. So it's just A, B, C, D, E, F, and G. So here's H. This last name is H. So we're going to go H-A. So we are going to find our H-A's, and we are going to file our film accordingly with our H's. And that's how we would file a film. So if we were still using a darkroom and actual film x-rays, the way we would be storing our film is in, we have a box down here that has film, and so you don't want to open the box with the actual lights on. You want to keep film stored in an upright position. You want to make sure the expiration date is noted on the film or somewhere around where you're storing your film, so you know which films are going to expire so you can use them first, following along the lines of first in, first out, so you don't keep expired film and have it just sitting around. The film is also pressure sensitive, so that's kind of why we have it stored in a box down here. So right now I'm going to show you how we would look up a patient's x-rays in our digital radiograph system. They are all stored here, or they are stored up in the cloud, but I'm going to show you how to look one up on this computer here. So on the top here we have our 3 different tabs. We have our to-do tab, our perform tab, and our search tab. So we're going to go ahead and search for a patient's x-ray. Here we have our, again, 3 different tabs. We have a quick search, a detailed research, and our search results. So we're going to go to detailed. So the patient name will go with one of my dogs. So the patient first name, and then the owner's last name. And then we're going to search. My dog has 3 different studies, and it'll show you again the patient's first name, the patient ID, so the chart ID number and the patient's name, and then the date and time that the x-rays were made. So the most recent one was last month on the 5th, and it will show the species, and then it shows which procedure was done. So right now we're going to go ahead and do a contrast study. We're going to be doing a contrast study on the esophagus. Contrast studies on the esophagus are good for evaluating the motility of the esophagus and looking for megaesophagus, things in that nature. So if I was going to need to measure my patient, I would measure at the highest area on the chest, and my collimation borders are going to be, my cranial collimation border is going to be right beneath the cranium, and then my caudal border is going to be just a little bit below my thoracic inlet. I've already got my computer system set with 2 of my lateral views, and then my settings up there are already calculated for me. So my KVP is 100 and my MAS is 5. And I've already got my machine set, so my KVP again is 100, my MAS is 5. And the dose for this contrast study is 15 to 20 milliliters barium sulfite mixed with some wet food preferably, and just syringe to the patient. Alright, so I have my patient on the table. I'm just going to have him lay down for me. Good boy. And then I'm going to go ahead and syringe him my barium and food mix right here. And this is going to go in the lapel pouch. I know it's gross, honey. You're being good. Begrudgingly eaten all of my barium and wet food mix. So now I'm going to put on some gloves, and I'm going to go ahead and position him in lateral recumbency. I'm going to grab his shoulders and bring them down just a little bit so they're not obstructing my view of the esophagus. Alright, and this is my first view. So everything has actually gone through quite nicely already. Alright, so again, that is my first view of everything going down.
Ready.
A couple minutes since we took our first view of his esophagus. Position him. And he's a bit fluffy. So I'm going to bring him up just a little bit more into my collimation area. Good boy. And this time I'm just going to bring his arms up a little bit. Bring his shoulder blades up just a little bit. Good boy. And then put his back out. Good boy. Good boy. Sit good on. This is my second view here, and we can see it's cleared all the way down, and I'm going to pull my marker down here. And that's where I'm.
Hi, my name is Katie Aiken. I'm a licensed veterinary technician at Acredale Animal Hospital, and I've been a preceptor for Chrissy through school. She just took her final set of x-rays for the semester. I've definitely seen a big improvement from when we first began. The patients have definitely been a lot more straight in the x-rays. I haven't missed any little bits and pieces, or missing the elbow, or missing the top of the diaphragm, or taking abdominal x-rays. Just everything looks like good quality x-rays that I could send off to the radiology specialist for a second opinion if we need it to. I've also been using the correct positioning aids when needed for restraint of the patient. She's been using sandbags to make sure that the body and legs stay straight when needed, and then also she'll use rolled gauze to be able to pull a limbs to ensure that she's not getting her hand or any limbs in the x-rays. She always wears her apron, the gloves when needed, and thyroid shield. I've just seen a big improvement, and the x-rays taken today all look perfect.